vital to come in here with some key data in terms of where we are.
Thank you, Bas. I have got some slides which we can send round to people afterwards. I've taken on a new laptop of my emails and we haven't synchronized. For example, we are seeing in relation to the booster, so that we know that those people that have had the 2 doses are, if those people are aged 40 and over, have been invited to have a booster, which is 6 months after the second dose. Based on current eligible people, what we are seeing is that the Pakistani community and the Bangladeshi community have the lowest uptake of the booster program, and that's the booster jab, which is for people that are 40 and over. Currently, it's between, well, for both Pakistani and the Bangladeshi communities, under 40%. Bangladeshi is slightly better than the Pakistani community by about 2 or 3 points. And the next 2 groups after that are Black African and Black Caribbean communities. For example, the uptake amongst the Indian community or the white British for the booster jab is almost twice.
Sophia, assalamu alaikum. Quickly, I'm live. So
In Bradford,
link was on.
Directors of public health, they have got access to this data. They should be able to give you real-time insight on the uptake amongst your community and issues where there are high levels of vaccination, unvaccinated. The second point I want to make, again, links back to Buzaid's point, is the data that we are seeing is that currently, in terms of infection and hospitalization, there are more people ending up in hospital that are under the age of 50. Not over 50s, those that you would classify previously at the beginning of the year, we were seeing more elderly people being admitted to hospital. What we've found is that those people, once they've had the first, and in particular the second jab, the percentage of people attending or being admitted to hospital is significantly reduced because their protection has been increased. There are still some people who end up, but they're not as critical. What we are seeing is people under 50 who have not had one jab or not had both jabs. And that is a worrying statistic for us because we are seeing more and more of our younger people admitted to hospital with infection and then getting serious, i.e. getting onto ventilators. So we have a big agenda to try and reduce our communities ending up in hospital by encouraging them to take their first dose and the second. And if the government invites them to the booster, they should take up the booster because it will protect our immunity or strengthen our immunity even further. So we have got data where we are able to see the impact of hospitalization for people that are not vaccinated. And obviously, I won't mention the economic impact because a lot of our youngsters work in our own businesses, going to our takeaways, restaurants. If they get infected, they have to isolate. So it's a small unit. And that means a team of 10 have to isolate, our business will close. And that has a huge economic impact. But at the moment, our focus is on people's health and lives. What we are seeing from the data is a significant adverse, i.e. negative impact on our Pakistani, Bangladeshi community and Black Caribbean and Black African communities.
Thanks, Abdul. Colleagues, we had a call very similar to this with colleagues from Birmingham, from the faith communities and a local community a couple of weeks ago. And one of the things that we wanted to find out is how could we work with yourselves from the areas that you represent and you work and live in terms of, one, getting vaccination rates up within your communities and your networks, but also what type of information will you need from us as an organisation to help and support any of the myths, the social media which is driving vaccine hesitancy, and also some of the support that we can provide from our colleagues on the ground, whether they be from CCGs, hospitals or public health. We have a number of doctors on the call today. Welcome Dr. Jungi Alam from Barts, good to see you. And obviously we've asked trusted voices to support our work. I'd like to open this up to yourselves in terms of what are you hearing, what else should we be doing to support the Bangladeshi community and individuals in terms of not only the first and second jab, but also the booster as well. I'll open it up to colleagues. Anyone?
This is Tahir Khan from Luton.
Hi, Tahir.
Just obviously we are all extremely concerned about the kind of less uptake by particularly the Bangladeshi and Pakistani communities, and I think it's about disseminating more information to these communities through the local channels that is available. And I have an organization called CYCB, and that has got access to a vast number of people. So I think it's about demystifying and addressing those myths that is circulating by making sure this information that is already available are disseminated and reaching out to those people. And in all different languages as well.
And Tahir, what are you hearing from the community in Luton? What are the blockages in terms of the myths and the concerns?
It's nothing different. I mean, it's nothing dissimilar to the what is already known. So it's more about whether the suspicion about this jab, the kind of conspiracy theories that is flying about, and whether this jab is really genuinely there. And then you also have people still thinking, there are small minority though, could be, but they're not probably taking that the COVID more as seriously as others who's taking it seriously. So yeah, it's a wide range of things. There's nothing specific.
Thank you. I'm going to bring. I've got 3 hands raised. Can I come on with Moin Kadri, please, first?
Hi, good afternoon. I will be very quick and brief. Thanks for the concise presentation. I would like to know that what is the factor of creating scaremongering among our community? Why they are scared. Those are not basically feeling safe and secure. Do you have any statistics that what is the mitigatory factor that is hindering from getting second vaccination or the booster? If you could inform us, it would be a great help.
Moin, you make a very good point, and I think Tahir's point earlier on, there is still a lot of suspicion and we need to build trust. People are still concerned. We've been in this situation now for coming up to a year. The anniversary of the jab will be coming up in the next couple of weeks, the first jab given. Social media hasn't helped. The concerns from people about what's in the jab, what does it lead to, issues around fertility, issues around, things being driven by, WhatsApp groups. It doesn't help in terms of people's confidence around the jab. And I think we've realised this has caused an issue, not just within the Bangladeshi community, but a lot of the other communities that have been resistant to come forward for either their first, second, or their booster jab. I'll be happy to come back to that question, but can I take some more questions from others? Is that okay? Dr. Nessa Chowdhury.
Hi. Salam everyone. Thank you for arranging for this meeting. Just going back to the question, actually, I was looking into why people are not having vaccinations. Office of Statistics has done a survey where the reasons behind assuming first dose is sufficient, which is asymptomatic. The respondents worry about long-term health effect, which is 34%. They think that booster should be given to somebody else, which is 33% of the respondents felt, and followed by they felt that they did not need it, about 25%. These are the broad category. But age-wise, what normally happens, people under the age of 50, they always think that the fathers, the uncles, the elder brothers, the elders, they and us, they say differently. They feel that we are not vulnerable, they are vulnerable, that they need it. This is one. And we very unfounded, unfortunately, unfounded worries over men about fertility, which is a big issue, and hormonal changes, along with the women, with fertility, with gynecological, whether there's any gynecological changes, etc. And mostly, many of the people think that, oh, I'm not going to get it. If somebody else is going to get it, but they do forget, because the COVID is in circulation at this moment, and vaccinated people are not getting it. So more likely the unvaccinated or partially vaccinated people are going to get it more. So these are the broad category, but there are on individual basis, there are some quite different and unheard reasons I've heard. It's very difficult.
Yes.
Thank you.
Thank you, Dr. Chowdhury. Can I bring Frida Yasmin in? Frida, please.
Yes, hi. Obviously, I will be speaking from our own experience, because as an organization, we are a very busy community center in Tower Hamlets, and we are in contact with around 5,000 local community every year. So what we've been hearing is the most common reason for this hesitancy are concerns around side effect, and this is probably echo with Dr. Nasser Chowdhury, what he just outlined. The side effect on short term and long term, because the people don't trust. The vaccine came out too quickly, and there hasn't been enough study on long-term effect, particularly amongst young people. There are also concerns around a lot of stories are going around within the community about, some people were double vaccinated, they still had COVID, and people died. Young people had COVID, they still died. So there is concern about the efficacy of the vaccination. More than 80% population are now vaccinated, then why there is still a huge rise in the infection rate? So that's also a growing pattern, and kind of throw into the trust issue. There are other issues like GP surgeries been closed for almost 1.5 years. The people rely on GP surgeries for whole of their life, and suddenly that trusted door has been closed. They don't have any face-to-face contact with their GPs, and that from our experience, is playing a big role on the vaccine hesitancy and concerns, because people don't know what information they can trust. They've been hearing from BBC News. There are information on social media platforms. So it's very confusing for people to believe who to trust.
Yeah.
The most trusted professional GP's door has been closed. And it's not good news, because they don't know why, places like us, our community center has been open to public since July last year, whereas people still cannot see their GP unless there is an emergency. And it's playing a big, the communities are missing out on that.
Yeah. Frida, thank you. I'm going to bring Dr. Zaki Rezwana in. Anwar, Doctor, can I have your input, please? Because I know that your time is very precious.
Thank you very much. This is Dr. Zaki Rezwana Anwar. I'm a mother and child health specialist, which is a section of public health. But people know me for my news reading anyway. So from my experience in the last nearly 2 years, what I have seen working with the professionals and with the general people from different backgrounds. When I live in Barnet. I have been working in conjunction with the Barnet Multi-Faith Forum, and I went to different mosques, church, synagogue, and spoke to across different age group and different genders. So what I have found that there is not only one problem. The reasons for lower uptake in Bangladesh is very different from Black ethnic minority. The main thing is in Black ethnic minority, they have the vaccine hesitancy. And in our community, we have vaccine reluctance. These are totally different things. And when we address this issue, I think we are not addressing this issue properly. So, as I said, this is different across the gender, across the different age group. For example, if we start with the women and the childbearing age group, like especially between 20 and 40, they are worried about the fertility. They think that that is one thing. And at the very beginning, even the health professionals, the midwives, they didn't have enough knowledge, because pregnant women, they were asking whether they should take the vaccine or not. And the midwives, they couldn't provide the proper information. And once, because of my medical and the media background, what I have seen that infodemic is equally dangerous as a pandemic. And this is true for not only for this pandemic. Historically, this is the case. So in the women's age group between 20 and 40, that's the fertility issue. And the other thing is they think that their prospective child, the unborn child, they will change the DNA. So in one sentence, answer to this question is vaccines that have been licensed in the UK. For example, the Pfizer, the mRNA vaccine. The mRNA vaccine doesn't go to the center of the cell. It doesn't go to the nucleus. And DNA is the nucleus. So there is no question of changing the DNA. Even the Oxford AstraZeneca, this group, it gives you signal specifically to do a specific job, not the changing the DNA. So, and these are the things. And because when we have had loads of programs, hours after hours, we never exactly answered these questions. That is one thing. The younger men, mainly, they are saying that this is our body, this is my body, this is my choice. I won't take the vaccine. I don't want somebody to push something which I don't know into my body. The answer to this question is, and another question they always say that the vaccine has been produced in a rush. So the answer to the first question is yes, of course. No, let me give the answer to the second question first. When people say that it has been produced very hurriedly, the answer to this is there have been, you only see the results. There have been research going on decades after decades, especially on the mRNA and even the Oxford AstraZeneca. Because loads of work that have been done before we started the pandemic. So when the pandemic started, it was quicker. It's not that we didn't, every stages were done properly. We haven't omitted any stage. And the sample size was bigger. There was many people. It's not like hundreds of people. So this is one thing. And also, I can tell you in this fact from today that because of the advancement of the prior work, you will see soon within next few years, the vaccine of AIDS will come. We already know that the vaccine of malaria has come. It's not getting the publicity because of COVID. So because in the next 4 or 5 years, you will see the lots of changes, the cancer treatment, and the medicine is advancing like anything. So it's not that all the works have been done in last 2 years. So that is one thing. And the second thing, when young people, they say that it's our body, it's my choice. Of course, it's your choice. If only you locked up yourself in a room and you don't want, you stay inside your house, you don't go out and you don't enjoy life. So what I would say to these people, this group of people, that when you go out, when you want to enjoy, you want to watch a movie, you want to go to party, that means you are enjoying the society. So rights comes with responsibility. You can't enjoy everything without performing your responsibility. So this is the thing, and this is not only my responsibility, it's not only your responsibility, it's a collective responsibility. It's not like I have a cancer, I have a choice, I want to go for a treatment. No, this is the corona is it's a disease which, you can't be protected if everybody is not protected. And I would say that we are very lucky. We're in the UK. We have got enough vaccines. Think about the people in the developing countries. They are looking for vaccines and they are not getting it. So we have the vaccine in abundant. And the other thing, if you go to a big senior group, they will say that they are hearing all these side effects. And the human psychology is when there is something fact, you have to prove with all the statistics, all the references. But if there is something wrong information, you just say it, and they tend to believe it. So the firstly we heard about the blood clot. That was like in 5-6 billion, 1 or 2%.
Dr. Anwar, can I draw you to very quickly, because there are quite a lot of hands up.
Yes.
I think you've made a very good point.
Okay, I will just go to the solution then.
Yeah.
I think the solution is, I think, is we, the health professionals, we are talking separately, and the community people, especially the religious leaders, they need to, the health professional and the religious leaders, they should speak on the same platform. So the health professional will explain the science bit, and then immediately the religious leader will say, it's not that he sending leaflets or other things. People like the moving pictures. So the media, electronic media is the answer.
Thank you. That was some very well made points. I'm going to bring Khusru Khan into the conversation. You've had your hand up for a while. Please could I ask colleagues to be brief, because we've got quite a lot to go through.
Okay, I'll be very brief. So, Assalamualaikum, my name is Khusru Khan. I'm from General Secretary from Greater City Council. I also work for the Social Work Manager in Birmingham City Council. Basically, Dr. Zakir Zwana and ourselves, she's part of the Greater City. We've been doing some work with UK Bangla TV to do online classes, online seminars on COVID and so on. And what we find is not a one-day solution job. It's a continuous, ongoing work that needs constant deliberation. And what we find, the question I would ask is it fear or is it ignorance? I suppose within our community is a bit of both, a bit of fear, a bit of ignorance that puts a barrier into community engaging or community receiving the appropriate doses of vaccination. I suppose a lot of the colleagues have touched on it. There are people within our community that mass population of Bangladesh population listens to, like the imam, local imam, that people go. And I guess with the NHS England, are they targeting those targeted groups? Do they know that where to actually go, rather than just doing a campaign which Bangladesh community don't access? Yeah. So I suppose it is a bit more work with the community organization, that actually grassroots organization that works with the Bangladesh community, such as you've got your online TV now, new online TV is coming along. They need to involve, the mosque needs to be involved, and like some of the colleagues just to go and join the imam during the Friday and then say, look, this is not a fearful thing, it's something that will help and support. Thank you, all below.
Thank you. Can I bring Sister Fatima Begum into the? She's had her hand up for a while.
Before Fatima, এই অনুষ্ঠানটাও LB24 এ লাইভ প্রচারিত হচ্ছে এবং আমরা অনলাইন চ্যানেলগুলো ইউজ করা শুরু করেছি। আশা করি এই মেসেজগুলো আমাদের কমিউনিটিতে পৌঁছবে। Thank you.
Thanks, Fatima.
Hi. Yeah, I think most of the stuff I wanted to say has already been covered. And Sister Yasmin said a very important thing that I'm in Luton. So I work for public health as well, and we do outreach in Watford. I work for Hertfordshire Public Health, and we went to mosques. We did Saturday outreach in mosques, and that is very it's just to inform people about the vaccine. That works really well. So I think we need to do that in other places. Someone already touched something, and one very important point Sister Yasmin said is the GPs. For 18 months now, I haven't been able to see my GP, contact my GP for various issues unrelated to COVID. But what happens is people lost trust because of that. And we need GPs to be more active. I'm sorry to those GPs who are here. We do say that we are losing trust in our GPs. So GPs are the only people we trust with our health, especially big issues. And if they come out and say, well, this vaccine is safe for you, you need to have this, then people are more likely to take it on board than someone from the community say. They will say, well, you don't have a degree in this. How can we trust you? So if GPs who are with the medical people come and say that this is safe, they will take it on board. Thank you.
Thank you, Fatima. Abdul Dois, please. You've had your hand up for a while.
You need to unmute yourself, yes.
Abdul, do you need to unmute yourself?
Yeah. Assalamu alaikum, everybody. It's nice talking to everybody and listening to everybody's perspective. I've been looking at some stats, and what I can see is that although we are lacking behind in the booster jabs, we're not very far off behind on the 18 plus and 50 plus of the first vaccine and the second vaccine, because we did do late catch up. And we are the third highest, in Bangladesh is the third highest taking of the 50 plus jab and the 18 plus jab. And in both jabs, we are like also the third. And the Pakistani community is a little bit further behind. So I think we are a late catcher. We start late and we do then attempt to catch up. I think what we need to do is just a suggestion that maybe when our patients go to GPs, and the GPs really need to encourage them. I mean, when they're going for a particular reason, they could say, look, have you taken your jab? Have you taken your booster? If not, I think you should take it. And they should really signpost them that way they can take it ASAP. I mean, there's like walk-in centers where they can take the jab. And also, another thing, what we've noticed is that the NHS England has been obviously doing a lot of advertisement, encouraging people to take up the booster jabs. But we don't see it in our Bangladeshi channel. We don't see it in the Asian minority channels. We don't see in an advert there like we see on parts NHS. Maybe that can be replicated in the Bangladeshi channels. And maybe they can send some resources there. And that is my intake. And I think, yes, we are on the booster, we are quite down. but I think we need to encourage everybody collectively, and I request everybody who's here to our own ways and our own means to channel the message across that booster is good, it is positive. Yes, there are some negatives, but the negatives are really, really minimum, and the good, the positive is maximum. So we need to get that message across. At the moment, be it social media, be it national media, they're picking up on the one negative case and really highlighting that, and that really sends this phobia to people like us, what to believe. They don't know what to believe. I see it every day in social media.
Thank you, Abdul. Mahmoud Hassan, please.
Thank you inviting me. We run a social. My name is Mahmoud Hassan. I am Chief Executive Officer. We are one of the leading health and social care provider in London, and we have got a huge number of care workers, and we have a care home as well. What we have been doing with closely working with NHS and the public health, and we made sure that 98% of our care workers taken vaccine, two vaccine. But regarding booster, there is lots of misinformation for the media that also affected. I think some of the care workers are thinking yes or no. But I think it's important that the campaign need to be taken properly. My previous colleagues have said about the GP. I think everybody, whenever you have health issues, first place to contact is GP. While GP is very negative, where they are playing, very difficult to get appointment, and it's very difficult remotely get proper guidance from the GP. So that's need to be more on. And also, the people said must. I agree with that, but at the same time, there are a number of community organizations in each borough. Everybody should take part in the campaign and inform the local community, and it is collectively working together. And also the lack of, it was a study, lack of black and white minority people in the NHS. And if NHS people are not taking vaccine, that it is a serious concern and it's a mistrust. And this kind of things, and also people hesitate. Is it concern about side effect? These are all the issues I think previous speakers has mentioned. So it is important that we can collectively work together and this campaign need to start. Yes.
Thank you.
Just to add that, I think government has lifted the restriction. I think people should wear masks on the basis, but government also does so many things confusing. And on the other hand, the non-ethnic people also campaigning. I have seen in Europe in various London demonstrations, which make people confused.
I'm going to have to bring you to a close because I've got time on hand. Yeah, thank you. Thank you. Colleague, can I ask you just to keep your points to ones that haven't been made already? Can I bring Mohammed Chowdhury in? Mohammed, can you hear me?
Ahmad, you need to unmute yourself, yeah?
Thank you. Can you hear me? Yeah, go ahead. Assalamu alaikum and good evening. Thank you. My name is Mohammed Chowdhury. I'm the president of London Bangla Press Club, which is the body of Bangladeshi journalists in the UK, and also I run a newspaper called Patrika, is the only broadsheet. We have just this week we have covered an editorial saying that what is the World Health Organization is saying in the next month or so what they are fearing for, and there will be about 500,000 people could die from this wave. And we are suggesting this is our editorial this week. You can see we have suggested people to take the vaccine because this is the only protection we know the best serve to fight the COVID. I think I will not repeat those concerns have been raised, but I believe and we can all realize that to build trust, it takes decades, it takes years, but to spread lies and to spread fear, it takes seconds. And as many of you have mentioned, that social media is the main channel for
disseminating misinformation. I think mosque is also opening the doors for vaccination centers. So I think we are all working from our own way, but there's a combined effort. In terms of confusion, government itself was confused, and there are still confusing remarks we are getting from different scientific communities. I think to build trust and to encourage people, the general public, we should use the local channel, as one of my colleagues has said. Channels could be the local media, the electronic media, and the bona fide and trusted traditional media should be used to promote the vaccination. That is my request. Electronic media, there are a lot of electronic media in this country from Bangladeshi community. There are 5-6 newspapers every week comes out, and we have been running government promotions for the last 2 years. But I think we have run lots of other things. It was not focused on vaccination to start with. It was focused for opening up. It was going back to school, how to safe travel and things like that. But I think because they have run lately some vaccination promotion, and what we do is just very specific thing we are doing with the government, that we are taking community voices to encourage people, and we are doing this sort of work with the help of the government cabinet office. So I think those work should be continued. Those work should be focused now in vaccination and booster job. I think that will create a difference.
Thank you, Mohammed. I think we will have a conversation with you after this call in terms of the offer of help. Can I bring my friend Sophia Alam from East London Mosque into the call?
Assalamualaikum everyone. Good to see a really great turnout of community leaders and politicians, doctors. I could just say the work that we've been doing at the East London Mosque and with the Mariam Centre and the London Muslim Centre has been one of collaboration with Barts NHS, and because we've been part of the discussions, the efficacy team to understand the vaccine, and been able to translate that back into the community. Alhamdulillah, since we started opening the vaccination centre, we've had a regular flow of people coming in. And that's because our imams went online, they reached out to the community and they said, this vaccine is safe, I've just taken it. We all took to social media, and I think just echoing some of the things that people are saying, I think it's we need to keep up with that momentum as community leaders and community activists, because people still do trust in what we say and what we do, and I think we can lead by example. And I remember the first time I took the vaccination and I put it on Twitter, and the very next day everybody ringing me to see if I was okay, if I had any side effects. So, you know, this developing of trust, it comes from doctors and politicians and community leaders alike. And I think, inshallah, we've seen some really great figures in the Bangladesh community, and we want to continue to see that, because we've seen far too much death. You know, the Islamic Mosque had to build a mortuary. And let's not forget that, and we don't want to go there again. If you look at the stats, we could easily slip into that. So we need to keep up with the momentum. So I'm glad everyone's here today, and we're talking about it. Thank you.
Thank you, Sophia. Colleagues, I'm acutely aware of the time. I want to bring Councillor Jahangir Alam into this, and I'll try and bring others in. Jahangir, can I ask you for your perspectives and your knowledge and experience?
Thank you, Abbas, and thank you so much for everyone for giving your input here. It's been really useful to listen to you all. I've been blessed with many of you over the past 18 months on the messaging around the pandemic and on the vaccine, colleagues at ELM especially. I've been listening to what you're saying, and I just wanted to put an offer out there saying, if you need Bengali doctors, Bangladeshi doctors to come out and speak to people in your community, we're more than happy to do that. But, I want to see people offer their services and how we can help you rather than solutions and identifying problems. How can we work together? So colleagues at the Bangladeshi Press Club, kindly offered to do some vaccine promotion. But what more can we do for you? How can we work together? How can you be the solution to some of these issues? So yeah, come forward and let's all work together.
Thanks, Jahangir. Can I bring Councillor Maya Ali into the call? Councillor.
Thank you very much. I'm not going to take much of your time. Thank you very much for inviting me to the show, or to this very valuable meeting, or this event. Now, what I would like to say is that I agree with everybody here that you really need to campaign. I still believe in the old-style campaign, although I know that media works. The old-style campaign is, say, we've got 49 members in this team today, Zoom meeting, and if every one of you 49, and out of your 49, goes out in your social circle and starts to campaign and starts to recommend and influence those people to look at their vaccine. If they've done the first one, go and do the second one, because I've done that to many of my social circle and my friends and family, and that does work. So that's what I will add, along with the lady who just who works in the council, Sufia Alam. She was very right, because people, it takes years to build trust, and you definitely need people like us, people who are in the forefront of the community, leading the community, or people who trust another to say, go and have that vaccine done, because this is what the government is doing. This immunity is part of the herd immunity. So everybody is vaccinated. Once they are vaccinated, they are very, very safe. Yes, one or two can go wrong, and there is a percentage that sometimes it might not work for you. One of my best friends has been affected by the second vaccine, and she's now developed a chronic illness. But again, this is 1,000,000 to 1. So do not be afraid of those people who are dying, or who have fallen ill out of these taking those vaccines. It's not it doesn't mean that it's you. You are protecting your children, your family, your social circle by taking that vaccine and being a part of the community herd. So I would urge every one of you here today that go out there and campaign with your own circle and family, friends, as well as social media, which is also powerful. Thank you very much for allowing me to speak. I know you've got limited time and so many.
Thank you, Councillor Ali. Can I bring Halal Chowdhury in, and can I ask the next 4 or 5 speakers to be brief if possible? Halal, please.
Good evening, everybody. I just want to say, I echo everybody what everyone said so far, but I think the NHS historically has not been consumer-friendly, patient-friendly. It is a very monolithic organisation, and I think what the NHS needs to do is employ local facilitators on the ground locally and work with all volunteer groups and faith groups and schools and youth clubs to spread the message. Talking to people on the ground actually persuades people to take the virus. Just another thing I want to express about the booster, I think there is a capacity issue with the booster. In Rochdale, I have been trying to book boosters for our elderly people, and it comes up as Oldham and Bury. There's nothing in Rochdale Infirmary. So I think the NHS needs to look at capacity, because that's an underwhelming, and the website is crap to book online. I've tried it and it crashes. There's no appointments. The way to do it is the NHS needs to work with local councils and open vaccination clinics in the community like Rochdale did. That's the way to do it, to promote the booster, and have a national advertising campaign in English, Bengali, Urdu, Romanian. That's my view. Thank you very much.
Thank you, Bilal. Very well made. Can I bring Mohammed Shah Jahan into the conversation?
Hello, is it me?
Yeah.
Hello, thank you for allowing me to speak again. Just 2 points I want to make very quickly. In our communities, the children are not the decision makers, so we have to reach out to the elders, who their parents, and that is very important. Once you convince them, their parents will be able to convince their children. That's one of the effective way, I believe. Secondly, I just would like to share that new advertising campaign should focus on what are the consequences if you are not taking vaccines. We have lost one of our colleagues who works our newspaper industry for decades. We have lost him last week, and I found out that he did not take the vaccine. We have got one colleague whose wife was almost in deathbed. She has recovered somehow, but I don't know how long it will take for her to be recovered completely. We found out that she did not take vaccine. Just before I joined this meeting, I was speaking to one of my friends. One of my friends, she's in 50s. She did not take the vaccine. She is in critical condition now, and doctors are suggesting to take her to the ventilation. So all these consequences, if we can expose to the people who are not taking it, I think that will be a story for them. I know it's sad, but that will be something for them to take it into serious consideration.
Thank you, Mohammed. Can I bring Dr. Abdul Kamali in here, who's been waiting for a while?
I don't think you missed me.
Sorry, I think that there's some confusion. Mohammed Shahzan.
I'll come back. Okay. Yeah, Abdul.
Yeah, hi. Can you hear me?
Yeah.
Oh, brilliant. Hi, my name is Abdul Kamali, one of the GPs in Tower Hamlets. I'll be very brief. Apologies for coming in late. I've just finished my clinic. I've heard the speakers in the last 20 minutes or so, and a few comments. First of all, yeah, I think it's an issue of negative media coverage versus the positive one. It's always a battle between them two. So I think we do need to campaign. That's the first thing. And I have done some work 8 months ago, so with Safa in London. I'm a GP from London, on Bangladeshi channels. And one of your speakers said we should probably use them because a lot of our Bengali population do watch Bengali channels. So I've done a lot of work with that. And the response I found was quite good. And I've done some work with BBC London News and then BBC nationally. And the response I found from my population, the patients I look after, has been very encouraging. And I think one person said, when GPs do go out, patients do trust you. So I think if we have an honest discussion, answer questions on Bengali channels, whether it's in Sylheti, Shuddhabhasha, or in kind of the mainstream BBC and other platforms, that does help. And I think what I would probably put out that although there's lots of GPs and doctors here, we're very busy, we're more willing to help with the limited time. What I would propose, certainly from my side, I do a health program on one of the mainstream Bengali channels with different aspects, and maybe one or two of them can be directed towards vaccine boosters and taking questions. We do get a lot of health questions from population, and people from across the country do call in, so that may be a good way to reach out to the population.
We would welcome the opportunity to use Bangla TV and social media to get messaging out. I think we know it works well. We are commissioning Channel S, and also Dr. Alam has been doing some work in terms of promoting vaccine uptake in the Midlands on Unity FM as well. Colleagues, I'm acutely aware of the time. I'm going to bring in 2 or 3 colleagues that haven't spoken. Mohammed Shah Jahan in, please.
Assalamualaikum. Good evening. My name is Mohammed Shah Jahan. I'm public governor of Oldham, NHS, and I worked for the last 21 years for NHS. What about this? A lot of speakers been covered. What I am saying. This need, most important things is for vaccination is trust, build a trust, and our community, lot of myth, lot of kushal, whatever is Bengali word, and another things, lack of this language barrier. This most important things, lack of advice, because it's our GP surgery on traffic jam, because it's no appointment, no advice, nothing. That is very critical condition. Our GP surgery is very important. What about my experience is need proper advice, and I already mentioned this lack of our language, lack of education, and our language barrier is very is very important things. And what I'm saying, our mosque is very important role going to play, and if imam are doing that sort of, they're taking part of our initiative of the vaccine advice and things. That will be better for us. Thank you very much.
Thank you. I'm going to bring Sabia Kamali in, and then I'm going to bring Tasia Mahmood in, and then we're going to wrap up if that's all right. Sabia.
Thank you, and apologies for coming late. We just had another meeting. What I wanted to say, for us here in London, I think Abbas has reached out to Marston Local Community Centre, which has been fantastic because it has made the vaccine aware for everyone else. But I would touch upon the fact that we need lots of information in bite size around pregnancy when women are pregnant and how it doesn't affect them, because it's a crucial thing, because even till today there are lots of women who refuse to take the vaccine due to the danger that it might, because obviously there hasn't been no research on pregnancy and the vaccine, so more information in bite size and TV, social media, all of those have been touched. But again, like Sister Sophia said, I think people go by trust, people who they know, imams, community leaders and that kind of stuff. So, I mean, information for women, mainly around women, if that's possible. Thanks.
Thanks, Sabia. Can I bring Tasia Mahmood into the call, please?
Yeah. Hi, assalamu alaikum and good evening. My name is Taisir Mahmood. I am a journalist. I am editor of weekly Cities leading newspaper in UK. I will not take much time. Just I want to throw a question. I wanted to know actually why the GP surgery is still not taking the appointment face to face. Still, we have to fill up the consultation form because the COVID restriction has been lifted out from July. So still they are not taking the appointment in face to face. If you kindly explain it.
I'm going to bring my learned colleague, Dr. Kamali, in here. Can you be very quick in terms of your presentation?
Sure. Thank you very much for the question. First, we want to see our patients face to face. I personally do want to see my patients face to face. There is a balance between the risk of spreading COVID, unfortunately, and keeping our patients safe and providing a good health service. Yes, restrictions have been taken off in lots of areas. The government has done that. We see the infection rates have gone up. Unfortunately, certainly in London and Tower Hamlets, we've had cases where if one of the receptionists gets COVID, then the whole receptionist staff have to go off isolating. That was in the past, I agree, and it affects the whole practice. That had to shut down. So whilst we are still doing telephone consultations, e-consultations, we do see patients. We do see patients if we need to examine them. So if we need to examine it, of course we will bring you in and see you. But to see everyone face to face, it does run the risk of spreading this, and we want to protect our patients. So that's the clinical reason. Of course, if someone wants to see me face to face, for example, today, I'll find out why they want to see me, and if we need to, then of course I will see them. And I've seen 5 patients today. So this is the reason we're trying to balance between meeting the patient's needs, they want to see us, and the clinical needs, and not spreading COVID. So that's the main reason why we're trying to do that, not because we don't want to see patients. In fact, we're working harder now, actually.
Thank you, Dr. Kamali. Really appreciate it. Colleagues, I'm acutely aware of time. I'm going to bring this to a close with the last question from Nazma Hussain, who's been waiting patiently. Nazma, please.
Hello, good evening, everyone. I'm health advocate. I'm doing vaccine clinics twice a week. And my point is there is a screening form there. I explain Bengali patient who can read and understand. But it is better if it is Bengali leaflet is there. So which one is information? Where is the information? This one, and also the screening one. If it is Bengali or Urdu or Somali language, then better for they can read and they can understand and they can consent. This is my view.
Thank you. I'm going to take 2 more questions, very quick questions. One from the London Bangla Press Club and one from Amin Babar Chaudhry. Please, sir, London Bangla Press Club.
Tarek, you should unmute yourself.
Okay. Hello, my name is Tarek Chaudhry and I'm the editor of Weekly Bangla Post. One question is about, one question about recently we have seen that oximeter is not working properly with the ethnic minority people, and we know the East London Royal London Hospital was the epicenter of COVID victim in hospital, first wave or second wave.
what is the answer now to make ethnic minority people believing that service will be provided on the proper equipment? Because we know this health secretary has ordered a review on the biasness of oximeter because it doesn't work properly on the dark skinned people. So what is the answer to?
You make a very good point, and I think we should allow that public inquiry to take place, because otherwise we will be here all night to discuss this point. But you make a very good point, and I'm sure it will be something which we will all be interested in because of the impact it's had on our communities.
Mr. Tariq Chaudhary is also a vaccine volunteer. Mr. Chaudhary is a vaccine volunteer. Thank you.
Thank you, Devon. Can I bring Amin Baba Chaudhary in for the last question of the evening?
Thank you very much. Assalamu alaikum. I'm from Oldham, by the way. Yes, I'm currently working with University of Chester in a COVID research program, study program. And I'm saying it's quite difficult to collect the information from our people, especially Bangladeshi and Pakistan. And I also did volunteer in the vaccination program. But my point, firstly, I wanted to say the solution about the increasing the. I have seen in older council, last year they brought the cricket captain to send a message about having the vaccination so people can take it. And I've seen a positive response from the community. And one thing I could say, everybody has already said many things, and I can replicate one of the things with the East London Mosque, which is one of the mosques which has got a huge, followers, and people also respect this organization. So they can do a national campaign with their way, and the whole country can replicate for a week, like we did in Channelist campaign, Walk with Dobir Sassa. There is a campaign to raise some funds, and it made a huge impact. So we could do something, either we could bring somebody from the sports, from the cricket, or some other games, and along with the Islamic leader to do a campaign nationally and focusing on having the vaccination. And I think it will make a huge impact. And finally, I want to say congratulations to Abdul Hamid for having a permanent role on Deputy Director at NHS. So thank you very much.
Everybody knows Abdul. Colleagues, I'm acutely aware of the time. Can I just suggest something very quickly? I've put in the chat that to take this forward, we need to have a WhatsApp group. I've put my email address in the chat, and we've set up a WhatsApp group for the Chinese community. We've set one up for the black community. We would really appreciate one for the Bengali community as well, because then we can send you information, we can take questions, we can supply trusted colleagues to come and speak to groups, whether you are from public health in the Midlands or from London or from the local masjids at East London or other areas across the thing. Please, if you want to be part of this WhatsApp group, please send me your phone number. I've sent my email is abbas@mirza4@nhs.net. I would really appreciate the opportunity to kind of send you information and take any questions from you, and how we can increase vaccine uptake across the Bangladeshi community and across parts of the UK. I'm going to say thank you to one special person on this call today, which is Khazrul Zaman. Zaman, you've pulled out all the stops today in terms of pulling people together from throughout the UK and from organisations that represent the Bangladeshi community. So thank you very much. And I would say thank you to everyone for coming and taking an hour out of your important day. I think we've made some progress, and we've heard lots of things which we need to take back to colleagues at the NHS and to colleagues on the ground as well in terms of how to take this work forward. So thank you again. I really appreciate your time. Have a good evening. I look forward to working with a lot of you in terms of the vaccine uptake program across the UK. Thank you very much. Thank you. Doctors.
দেখুন তো, করোনা ভাইরাস সবাইকে এফেক্ট করে, এবং করোনা ভাইরাস থেকে মুক্তি পাওয়ার জন্য আমাদের সবাইকে এগিয়ে আসতে হবে, নিতে হবে ভ্যাকসিন, নিতে হবে NHS এর অ্যাডভাইস, এবং সেই অ্যাডভাইস নিয়েই সেই ভ্যাকসিন গ্রহণ করেই আমরা আমাদেরকে নিরাপদ করতে পারি আমাদের পরিবার, আত্মীয় স্বজন এবং আমাদের সমাজকে। আমরা যদি ভ্যাকসিন না নেই, লকডাউন আসবে, আমরা নিজেরা ব্যক্তিগতভাবে সাফার করব, আমাদের পরিবার পরিজনকে আমরা হয়তো এফেক্টেড করতে পারি। তাই আমাদের সবাইকেই সতর্ক থাকতে হবে, সবাইকেই ভ্যাকসিন গ্রহণ করতে হবে, মাস্ক পরতে হবে। আমাদেরকে এই ঠান্ডার সময় যারা উপযুক্ত আছেন দয়া করে ফ্লু ভ্যাকসিন নেবেন, কারণ ঠান্ডার সময় ফ্লু অনেক সময় আমাদেরকে খুব কাবু করে ফেলে। এবং যারা রিস্ক গ্রুপে আছেন তারা অবশ্যই আপনার জিপির সাথে যোগাযোগ করে ফ্লু ভ্যাকসিন নিন। এই সপ্তাহে শনিবার রোববারে গ্রাব এ জ্যাব ক্যাম্পেইন শুরু হচ্ছে সারা দেশব্যাপী। আপনি যদি সেই সুযোগ পান, হাই স্ট্রিটে গিয়ে বা যে জায়গায় আপনার এলাকায় সেই গ্রাবে জাব দেওয়া হচ্ছে সেখানে গিয়ে আপনি ভ্যাকসিন নিন, জাব দিন এবং সুস্থ থাকুন, নিরাপদ থাকুন। লন্ডন বাংলা 24-কে অসংখ্য ধন্যবাদ এই লাইভ প্রোগ্রাম করে আমাদের কমিউনিটিকে ভ্যাকসিন নেওয়ার জন্য উদ্বুদ্ধ করার জন্য। আমি ধন্যবাদ জানাচ্ছি। আপনারা সবাই ভালো থাকুন, সুস্থ থাকুন। আল্লাহ হাফিজ, আসসালামু আলাইকুম।